Welcome to Week 9, Part 1, The Health of Adolescents and Young Adults. So why is it so important to think about adolescents and young adult health? Well, first of all, during those years, important health behaviors are set during adolescence. The burden of disease is quite unique for adolescents and young adults, and there's important links to the Sustainable Development Goal with respect to the burden of disease linked to adolescence. So adolescence is a very critical transition period. You start off with the physical changes during puberty. You have the improved ability to start thinking a little bit differently, some introspection. You have more susceptibility to peer pressure, and you have this perception of low risk, that that's not going to happen to me. So they tend to be a little bit more risk takers. In late adolescence, again, you have the continued physical growth, you have more improvements of your critical thinking and decision making, you become more independent, and you start to transition into that young adulthood. And then young adulthood, again, you have the final organization of your brain, you have enhanced reasoning, self-regulatory functions, and start to develop those adult roles and responsibilities. So you can see how that critical transition period is very important. There's many charts that you will go through in the textbook, and this is just looking at the leading causes of death among adolescents and young adults, depending on where you live as per income level. So you can hear, this is the chart for low income levels, and for males versus females, you can see the majority for males are related to the surrounding, the environmental surrounding. So you have a lot of communicable diseases. There's road injuries. There's interpersonal violence. And for females, again, a lot of the communicable diseases, but also the maternal hemorrhage and the indirect effects of maternal deaths. So low middle income countries. Again, a lot to do with maybe childhood vaccinations. A lot of diarrhea, lower respiratory tract infections, TB are a large mortality risk for adolescents in these areas. Unsafe water sanitation. Low middle income countries, again, you start to see the transition from not as much as the communicable diseases, so you start to move into conflict and terror, self-harm, interpersonal violence. Again, similar with women, you have the same communicable diseases, but a little bit more self-harm you can see, maternal hemorrhage. As you move into upper middle income countries, again, you start to move away from those communicable diseases. Now, road injuries are the most prevalent. Interpersonal violence, drowning. You start to see the development of leukemia and maybe some non-communicable diseases, so cancer, congenital defects. We move into females, again, road injuries, the number one. HIV, AIDS, so relating to a little bit more into those sexually transmitted infections. Self-harm is there, interpersonal violence, leukemia. So childhood cancers, adolescent cancers. And then the high income countries, again, you've moved away specifically from communicable diseases. Now you're into, again, road injuries, self-harm, interpersonal violence, drug use, drowning. For females, again, road injury, self-harm, interpersonal violence, getting into a little bit more of cancers, brain cancer. So you can see, it's interesting how you can see the transition from low income countries to higher income countries. So this is just kind of an overview. So early adolescence, most of it's in males, road injuries, diarrheal and intestinal infectious diseases, drownings. So here we're looking at adolescence in general. So early adolescence. So males, as we've said, road injuries, diarrheal and intestinal infectious diseases, drownings. Females, again, communicable diseases, road injuries, some issues with deaths from malaria due to anemia. Males, the older adolescents, road injuries, interpersonal violence, self-harm. Females, again, self-harm, maternal disorders. So looking at those lower middle income countries and the impact of having pregnancy early in life, road injuries. And then young adult, road injuries, interpersonal violence, self-harm. So you can see the little bit of the risk-taking that you see in the male populations. and females more disorders, maternal disorders, self-harm, and road injuries. So you can see the impact that road injuries, it's coming out loud and clear that in a lot of low middle income countries, there's a lot of injuries related to the poor infrastructure of the roads. I want to bring to light that adolescent girls in low middle income countries face a particular challenge as opposed to girls in high income countries because they tend to assume more of the home related chores. They're married at a younger age. And so they have the issues related to early pregnancy and birth. So a lot of adolescent girls who give birth are at increased risk for birth complications and maternal mortality. So I want to focus in on some specific areas. So iron deficient anemia is seen quite often in childhood due to undernutrition. We see a lot of undernutrition and stunting prevalent in our low middle income countries. It's a leading cause of DALY, and it leads to a lot of long-term consequences. So long-term consequences with respect to productivity, impaired immune function, cognitive impairment. And so you can see why children may not be as productive in school. HIV, AIDS, and other STIs. So 2 million adolescents are living with HIV, AIDS. In some countries, 60% of the new HIV infections are occurring in this age group. It's concentrated in sub-Saharan Africa, and it's due to the fact of risky sexual behavior, alcohol and drug use, not having access to contraception. And girls are at increased risk because of their biological differences and also gender norms. So biological differences mean they're more prone to STIs. Other communicable diseases. So in countries that don't have a good childhood vaccination rate, you may have a high rate of communicable diseases, and diarrhea, lower respiratory, meningitis, TB are still the leading causes of mortality of adults and young adults in low middle income countries. And then don't forget about our non-communicable diseases where we're seeing this in our higher income countries. 1 in 4 adolescents don't meet the recommended guidelines for physical activity. In some countries, as many as 1 in 3 are obese. And then the rate of smoking is decreasing among adolescents and young adults in high-income countries, but increasing in middle-income countries. So again, leading to this heart disease, diabetes. Mental health, we know depression is the leading cause of DALYs and self-harm is the leading cause of death. So important. The common mental health issues are anxiety, depression, conduct disorders, and they have many related risk factors related to violent behavior, risky sexual behavior, so increase in HIV, AIDS, and substance abuse. Road injury. So they're the third leading cause of death among those aged 10 to 14 years and the second leading cause of death among those aged 15 to 24. And males are at increased risk because of cultural and behavior factors, more risk-taking. Interpersonal violence is a leading cause of adolescent and young adult mortality, resulting in about 180 deaths every day. Adolescents in low middle income countries, there's 1 in 3 deaths are caused by violence, and 30% of girls aged 15 to 19 are victims of interpersonal partner violence or intimate partner violence. And so if we look a little bit broadly and step back and look at the economic and social consequences, you can see how it's very important to maintain the gains that we're trying to make with child health. We tend to focus on child health, and then we lose sight of what's happening with our adolescents and young adults. And so we need to remember that health behaviors set the foundation of adult health, and these are set during adolescent and young adults. And so we want to make sure that we have adults that are productive and have good potential. And so by not focusing on this age group, we have future losses in our adult population. And there's high costs associated with morbidity related to HIV and TB treatment. And so some of the key interventions for improving this group of individuals is looking at that life course perspective to prevention and treatment, improving educational and employment opportunities, promoting universal health coverage to allow better access for adolescents and young adults. And then make it accessible and friendly for adolescents and young adults to get the healthcare access they need and the healthcare coverage. So make it more friendly and open. And maybe break down the data into early adolescence, older and young adulthood like we've done here to better identify the group needs.